Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
One in 10 nurses is leaving the NHS in England every year, according to the latest figures. And the gap between the number leaving and those joining has widened to 3,000, the highest for at least 5 years. The Royal College of Nursing says the NHS is hemorrhaging staff, but the government says it has plans to boost recruitment. Our health editor Hugh Pym reports.
Voices from the front line, nurses on the challenges of their jobs in the 70th year of the NHS.
They do it because it's in their bones that they have this desire to care for the most vulnerable people.
Just having a lot of patients to look after per one member of staff, so patient to staff ratio is quite high.
Much of the work that nurses carry out today is the type of work that doctors were carrying out when I initially trained.
But for some like Mary, the pressures are so great they feel they have to quit. She qualified 2 years ago, but she found the strain was affecting her health, so decided to leave.
I was so excited at my graduation to finally become a nurse and really make a difference. There's just so much pressure, so much paperwork, so much bureaucracy, so many little things that all add up to take up so much time in our days.
Even those with decades of experience say the stress is almost too much. Sally joined the NHS in the late 1970s. She's enjoyed her career, though says the demands are much greater because the role has expanded.
Never when I started nursing did I imagine I'd be doing anything like the role I'm doing. I don't think it was even heard of.
The government says the number of nurses on the wards in England has gone up by nearly 12,000 since 2010. But when you look at all nurses, including community and mental health, the figure has barely increased over that time. Last year, Wales, like England, saw more nurses leaving than joining. In Scotland and Northern Ireland, there were more joining. Filling vacancies is certainly a challenge, but for the NHS, what's just as important is retaining existing staff. At a time of concern about pressure on the service and what future pay deals might be, it's important for employers to do everything they can to persuade people to stick with their careers.
Anything I can help you with today?
I'm okay at the moment.
Yeah.
There's a mentoring scheme at this hospital in Romford. Megan was encouraged to stay thanks to support from Bev.
In my other trust that I've worked in, you didn't have someone like Bev, you didn't have someone to turn to and make sure you was in the right environment for you. So she's just been amazing.
It's really important.
NHS England wants to see that approach adopted more widely.
We want to work with frontline staff to understand what matters to them and then to listen and to try and do something about that. Clearly it's difficult at the moment.
The government says there are more new nurse training places in the pipeline, but in the short term, the pressure's on. Hugh Pym, BBC News.
Well, we can probably all agree that what the health service does not need right now is more nurses leaving. But new figures suggest that last year, 33,000 in England did just that, whilst only 30,000 joined up, which suggests the service is fighting a losing battle on recruitment at the exact moment it needs to be in a winning one. Hospitals are doing their best to respond, of course, with some of the extra demand coming from an increasingly elderly population. Hospitals are working out ways to deal with them more quickly when they come to A&E.
Hillingdon Hospital is under pressure like every other. Beds in this frailty ward are regularly fully occupied and A&E waiting times are way below the government target. It's a familiar story and so acute. Elderly patients here are being assessed away from A&E to alleviate some of the burden.
There are lots of pressures in the system. This is certainly one of the things that helps us cope with those pressures at the front door, and being able to manage the flow within the hospital and help patients move out into the community to get the care and support that they need within their own environment certainly helps some of the pressures at the front door.
All hospitals are having to cope with extra demand this year. The NHS's Discharge to Assess scheme is aimed at preventing frail patients languishing in A&E. But Hillingdon is only one of a few hospitals using the system.
This initiative has managed to cut the average length of stay of its elderly patients by 2 days. Here, most patients are assessed and discharged within 72 hours. It's a system that has helped keep this hospital operating safely.
The number of patients coming through the doors are just part of the problem. Understaffing also adds to the pressure. Today, research shows there are almost 320,000 NHS nurses and health visitors working in England. Last year, 33,000 of them quit, more than 1 in 10. But the NHS managed to recruit only 30,000 replacements, and that's the third consecutive year there's been a shortfall. More than half of those who left the profession were under 40. At 20, student nurse Jodie Apollina is just starting out in her career. She's dismayed so many want to leave so soon.
It does worry me when nurses leave professions, because sometimes I feel like there won't be enough nurses out there to be able to help when nurses leave. It gets you a sense of negativity.
The government insists initiatives are in place to help retain and train nurses. The Royal College of Nursing, though, says it's too little too late.
This is entirely predictable, this situation. Posts were cut to balance the budget in many organisations across the NHS some years ago, as were training places cut as well. So we had that perfect storm of not enough nurses and less coming in, and that's come back to hit us now. Hello.
Managing the huge increase in patients while understaffed is the NHS's #1 challenge. But as patient numbers continue to climb, many feel there is only so much it can do.
And Emily joins us now. Well, we've got more news out tomorrow. Is that likely to show any indication that this crisis is, easing off at some
Getting
level?
any better?
Yeah.
No, I don't think so. I don't think it's going to get any better anytime soon. We, as you say, got a raft of stats out tomorrow. The first of which are the winter weekly situation report in England, and that will show us things like how many ambulances were diverted to different hospitals, how many A&Es were closed, and I don't think it's going to make good reading. The A&E waiting times last week in England were appalling, so that doesn't bode well. Also, out are the A&E waiting times in Wales for December. We know that New Year's Eve was the worst night of the year in Wales for A&E. I think we can expect waiting times to be well below the government target. The question is how much below. The most interesting thing for me, though, is I've been travelling up and down the country over the last 2 weeks. I've been speaking to people in A&E. Staff are saying that they are coping. They are finding ways of alleviating the pressure. And that is a completely different summary to what patients are saying and indeed what the stats are saying. So there's two different stories really coming out of this winter crisis. I think in short, tomorrow, it's not going to be a very happy day for the NHS.
Well, it hasn't had many recently, but we'll see. No doubt you'll be here, and so will I. Speak to you then. Thank you very much for now.